Today, our panelists are the House Speaker, Scott Saiki, to my right, the Senate Majority Leader, Kalani English, to my left, and Eleni actually introduced herself on her own. But let me tell you a little bit more. Her coverage is funded in part by a grant from Report for America. She covers disparities in healthcare outcomes and access to care among Native Hawaiians and other ethnic groups, low-income communities, and residents of more remote areas. Is that correct?
That is correct.
You'll have to talk to the senator at some point because he has just about the most remote district there is. Bring your microphone a little closer, if you wouldn't mind.
Yeah.
And there's Alana with the index cards. Okay, without further ado, let's jump into the topic that everybody is talking about. I'm going to ask these first series of questions both to the speaker as well as to the majority leader. And I'm going to call them Kalani and Scott from time to time because I've known them for a long time. And Eleni as well, who I have had just the pleasure to know just a short time, but I know her family, so that's great. Can you give us an update on what's going on with the legislature in terms of response to the coronavirus threat? As you may have heard, there is now a death in California, and I believe there's an update locally that we'll get. No deaths locally yet, fortunately, but we'll go to Eleni in just a moment. But I think I do know that the Senate passed a $10.5 million emergency spending bill at the request of the governor. It still has to go through the process. And then the speaker has introduced a resolution that will be voted on tomorrow regarding setting up a commission to address what the state needs to do in response. I'll let both of them address both points. Speaker, why don't we start with you? What's the latest on the ledge and what it's doing to respond to coronavirus?
Sure, Chad. Thanks. So, thanks for inviting us today, and thanks everyone for attending. So I think that when we began this session, nobody thought of coronavirus, but it's here, and I think it's going to be top of mind for everyone in the public as well as for everyone in the legislature. And I just want everybody to know that the members of the legislature are very focused on this issue. We're trying to stay on top of what is happening so that we can respond to it if necessary during this legislative session, because we are in session through May 7. That is our scheduled adjournment date. So we do have almost a couple of months to propose any legislation that might be required between now and the end of session. Just to give you some information, because these are some of the questions that I was always kind of curious about with respect to coronavirus. So as of yesterday, fortunately there is no diagnosis in Hawaii, but there are 89 people who have been self-quarantined. The state health department did receive test kits over the past week, and so they are beginning testing. And I was kind of curious, what is a coronavirus test? But basically what it is, it's a test where a swab is inserted through someone's nose and it goes to the back of their throat. The sample is taken, and then it takes the laboratory between 24 and 48 hours to analyze that sample and to determine whether it's positive or negative. The health department currently has the capacity to conduct about 250 tests per week on a routine basis. If there is an emergency, then they can go up to about 500 tests per week. So I think the health department has done a really good job given finite resources to prepare us on the medical front. Because of the emphasis that has occurred on the medical side, one of the questions that we were asking ourselves in the House was, is the state prepared to deal with this on an economic and financial front? If you look back at the recession that occurred in 2008 and 2009, the state took a big hit during those 2 or 3 years of that recession. We lost $2.1 billion from the state treasury over a 3-year period as a result of those cuts. As you may recall, the state instituted furlough Fridays. Our school weeks were reduced from 5 days a week to 4 days a week. The state cut millions and millions of dollars from essential services, such as mental health services. And as you know, we still feel the effect of those cuts because we have not made up for all of the losses in mental health professional positions that were cut during those years. We also cut services in environmental programs, homeless programs, and housing programs. The state also, we saw an unemployment rate of about 7% during that time, and there was a loss of about 40,000 jobs as a result of that recession. We want to be prepared. We do not want to see the state having to take very drastic last-minute measures if we are hit financially. And that is why the House created a select committee on COVID-19 economic and financial preparedness. The House actually adopted the resolution yesterday. It was a unanimous vote, 51 in favor, to create a committee that will be comprised of representatives from the various sectors within Hawaii, as well as a few House members. And what we will be doing is meeting on a regular basis to assess what is happening within our economy, how businesses and industries and workers are being impacted, and what, if anything, the legislature and the state can be prepared to do in advance to prepare for that and to be preventive. So that is the
Okay. Thanks for the update on the reso. Didn't realize it had been voted on yesterday. And if I understood correctly, you said that could result in legislation and even appropriations this session before May 7th.
is possible,
Okay.
such as the one that Kalani will.
Yeah, which I'm going to turn to Kalani now. And Kalani actually wrote down COVID-19. I'm not taking to that term yet. Even in headlines, we're still using coronavirus. And I think everybody else is maybe at some point. But coronavirus is a more generic term. Is that correct? That could apply. I should check with Eleni on that. But Scott handed it off to you, Kalani, regarding the $10.5 million. Where's the status of that legislation?
Well, so just to be clear, the governor has emergency powers. He's the only one that can send down a bill for emergency appropriations. And what that means is that the money will be spent between now and June, right? So it's for right now. It's not for the next fiscal year. So he sent down a bill, a request for money. It started out, I think, $6 million. And then as we talked in the days, asked for what exactly is going on, what exactly is needed, stronger numbers came in. So at the end of the day, we passed about $10.5 million. And I think that number may go up as it goes through the House. But it's for monies right now, and it's for emergency response. Things like preparedness for National Guard, preparedness for Department of Health, preparedness for Department of Education, and also for supplies, movement of supplies throughout the region. So I'll give you an example. One of the questions that we asked of the administration was, what are the stockpiles in the remote and neighbor islands? Because if you recall, a few years ago, our Department of Defense consolidated all the supplies on Oahu. So for me, representing 4 of the 8 major islands, it's very important to know that we have supplies on Maui, Molokai, Lanai, and even the Big Island and Kauai and the rural areas. So the monies that we are talking about right now is for expenditure immediately. As you know, there's been a run on supplies and even medical supplies. And to understand it clearly, a lot of our pharmaceuticals come from China, and there's been a break in the supply chain. So some very basic things that we normally get are getting more difficult to get. So we'd like to procure those now. The bill passed the Senate and is being sent to the House for their consideration. I'm sure that they'll take this up immediately and move forward. And they may add more as the administration comes back with stronger numbers. Now, with that said, I'd like to talk a little bit about overall, but what the term we can use is continuation of government, right? Continuation of services. We have not faced a pandemic type situation in Hawaii for a very long time. The last major pandemic, there was one in the 60s in the United States where they quarantined people for the flu in the early 1960s. And then before that, it was the Spanish flu in 1916. But if you go back farther in Hawaii's history, we are very prone to the effects of pandemic. Look at the Hawaiian population, where we had probably more than half of the Hawaiian population wiped out because of the common cold, because of influenza. Then if you look in the Pacific, the Marquesas Islands, 90% of their population died because of influenza. You go to other countries, Samoa. Samoa, that you remember recently, had a measles epidemic. Well, in 1918, the New Zealand authorities allowed a ship called the Lurleen to dock there, like our cruise ships today, and they knew that there were sick passengers on that. That docking of the ship wiped out about 60% of their population. So in the Pacific, we're very, very acutely aware of the effects of pandemic. So one of the things that the Senate is doing, Senate President has asked that we examine within our infrastructure, how do we continue operating all branches of government in time if and should the virus come to Hawaii. So my grandmother always said, you hope for the best, but you prepare for the worst. And that's what Hawaii is doing. We're hoping that it doesn't come. We're hoping that we don't get it, but we are preparing, right? So in part of that preparation are things like, how do we continue the operations of government if there's a pandemic, if we do get the virus here? How do we make sure that services are provided? How do we make sure that the courts operate? So just take the courts, for example. You subpoena somebody to come in, they are compelled to appear, but they're sick. And if they're compelled to appear and they come in and say, you made me come, I'm sick. So we have to talk to the courts and say, if someone's subpoenaed and they're sick, will they waive the penalties? Will they say, if you're sick, get a doctor's note and we will postpone? Things like that. So the Senate and our side, the Senate President has asked us to begin looking at what we call the continuation of services, continuation of government. The other big overarching issue is, an economic one, and that's the continuation. I have to use, macroeconomic terms, but it makes sense. The M1, M2, M3 money supplies, right? Make sure that credit moves, that capital moves, and that actual cash is available. So then it comes down to things like, if we have to quarantine mass amounts of people, how do we continue their jobs and make sure that they get paid, right? So that the mortgage gets paid, the electricity gets paid, the tuition gets paid. How do we make the arrangements so that we don't stop the flow of money in our society? So these are the big questions that we're looking at. We're reaching out to partners to think through this. We've asked some very smart thinkers, some economists, and some other people, APCS, Asia Pacific Center for Security Studies, and other think tanks in Hawaii to begin running scenarios for us so that we can be prepared. So the idea is that, again, hope for the best, but we want to prepare for what may eventually come. And if a pandemic does come to Hawaii, we want to be able to say to everybody, these are the things we advise you to do, and together we'll get through it. So that's the position of the Senate.
I am going to ask Kalani and Scott to speak a little bit about the Council on Revenues, which will be meeting next week, I believe. But before we do that, Eleni, I wondered if you might just give us an update, anything that wasn't mentioned in terms of the coronavirus here locally. Just if you didn't see, the governor today appointed Josh Green, who some of you know is a medical doctor, to be the liaison to the health community regarding coronavirus. That just happened just now. And I believe United Airlines has announced that it is cutting back on its domestic and foreign flights and staffing. But I think the DOH was going to have another meeting today, and there's an update on test kits.
Yeah. Hi, I'm Eleni, and I've been covering the coronavirus for Civil Beat. So the most recent news is that Hawaii has deployed or conducted 6 tests so far among 6 different patients from a number of different islands here. All of them came back negative. So there have been no confirmed cases of the coronavirus yet in Hawaii. Testing just started last Friday. So officials have been saying, as we start to test more people, we might have more people under investigation for suspected cases. So we'll see that PUI, or people under investigation count, go up quite a bit. One thing to keep in mind is that not everybody is going to be tested in mass. You need a physician referral. So if you are starting to feel sick, the first thing you would need to do is go see a doctor, and then they would approve a coronavirus test for you. And the physicians will also base their decision to test you based on a number of criteria, which are changing by the day and are slowly expanding. But we're taking the CDC standards from the Federal Health Agency to determine who should be tested. And of course, if people are showing symptoms like cough or fever, shortness of breath, in conjunction with having a travel history to many of these places that now have growing number of cases, including China, of course, Japan, South Korea, Iran, and Italy, the doctors will sort of take that into account and work with the Department of Health here to then have that patient be tested. The folks in self-quarantine, staying at home, that number is I think above 90 now, and that's sort of a precautionary measure for folks who probably, most of them are not showing any symptoms, but they stay home just in case they start to have any symptoms, and they are being monitored by the Department of Health. But I think one of the big questions that I've received just from readers is, why did it take so long for the U.S. to start testing? And it was unfortunate and kind of surprising that the first batch of about 100 testing kits that was distributed across the nation resulted in a false positive. And so that led to a delay of more than a week. And so, folks, especially in Washington State, I know some doctors have been raising concerns about that because perhaps, the virus might have already been circulating and we weren't testing. And so I think the Department of Health is aware of that. When I spoke to the Director of Health yesterday, and they're about to do an update, I think in like a couple minutes, actually, across the street. At some point down the line, if we need to administer more tests, we'll be able to either order more from the CDC. We'll be able to potentially rely on private laboratories here in Hawaii and on neighbor islands as well. So hopefully that will allow for people to get tested more quickly as the need arises.
Two questions. I'm guessing everybody in this audience knows because you're smart and you stay informed, but the masks really don't help. Is that right? Unless you're...
Yeah, so the masks, the number one recommendation is to wear a mask if you yourself are sick. And the purpose is to keep you from getting other people sick. However, a doctor also told me that, the thing that we need to be most conscious of is washing our hands and not touching our mucous membranes, as they call it. So wearing a mask actually might prevent you from touching your own face, which is a good thing. I've been trying to keep track of how many times I touch my own face in a day, and it's alarming. So I think, you don't necessarily need to have one of those masks. That should really be reserved for our healthcare workers who really are on the front lines and might be dealing with suspect cases. But you could, wear a scarf if you're feeling uncomfortable and you want to just watch yourself and not touch your face. And so there have been shortages of masks, around the world, and the supply chains in China have been affected. So that's just something to think about.
Okay. And just one final question. I know you're not a medical doctor, but this is your expertise covering health, but just what's your gut telling you? Is this really as scary as it sounds like it is, or is there some exaggeration?
So
in the media being involved and so forth?
I would love to address that. I think something that we should all keep in mind is when we look at the experience of China, it's been really tragic. But one thing to keep in mind is that about 80% of all of the infections were mild. And a lot of people were able to recover at home. So we might see something similar here in the islands where not everybody will require an intensive hospitalization. So hopefully you can take some comfort in that. I think it could play out like a very, very bad cold or flu season, but then at worst, there could be a significant number of patients who do need that intensive care. And so we have about 166 isolation rooms already at hospitals across the state where they have negative air pressure. And so the hospitals are preparing for the worst, of course. And so it's important to keep that in mind. But I also think this is something that folks should mentally prepare for, actually, because there's a lot of stigma around it. Any of us could possibly get infected at some point. I think it's probably inevitable that we will have a case in Hawaii. But it's also to think about if you are at home and you need to recover from home, how are you going to keep your family members safe? How are you going to stay in isolation? How will that affect you mentally? And, also the transition of maybe working from home for a while. You maybe start talking to your employers about that and see how flexible it could look in the future.
Thanks, Eleni. Did you want to add something, Kalani?
Yes, I did. There's been a lot of precautions taken, and I really want to congratulate and thank all of the businesses and all of the nonprofits and organizations that have already taken on the precautionary principles. All right, employees, if you can work at home, I know a lot of businesses have done that. Just reminding people to wash your hands, 20 seconds, sing happy birthday twice. I mean, things like that. But really, Hawaii, so, I'm the chairman of the Festival of Pacific Arts, and we announced on Monday that we're canceling a very, very large international festival. And we did that really with the idea was that we have to protect the citizens and people of Hawaii first and foremost, right? So with delegations from 28 countries from the South Pacific coming in, they were concerned. I don't think any of them have the virus yet, but they were concerned of being 14 days quarantine going home because they passed through other countries. So consider trying to get a month to get home, right? So it was both sides. We thought that it was the best thing to do was to cancel.
When was it scheduled for?
It was scheduled for June 11th to the 21st
Okay.
of this year. We're moving it ahead 1 year. But that's part of the precautionary principle, like large gatherings. I want to commend the Honolulu Festival because they started canceling bits and pieces. And then finally, they just said, you know what, for the safety of everyone, let's just cancel the whole thing.
That was this weekend.
That was yesterday.
So,
yeah. So just to say, acknowledge that everyone has pulled together and people have made individual and corporate and group choices that make a difference.
You know that when Mariah Carey has to cancel her concert in Hawaii, it's a serious deal. Scott, let's turn to the Council on Revenues. Just briefly, what does the council do to inform the legislature for its business? And what are you expecting when we get an update?
Okay, so Chad, as you know, the Council on Revenues is a body that's created by the state constitution, and it's comprised of financial and economic experts. And they meet every quarter to assess and determine what the state's growth rate will be. And the state constitution requires that the legislature use the council's numbers when we meet in session to approve our state budget. So the last projection that we received was in January, and that is the version that is the number that we used when the House took up the state budget, which is now in the Senate for consideration. The growth rate that we used was about 4.1%. The council will be meeting next week on March 11 to reassess what that projection should be. I'm assuming that it'll go down.
And is that through the end of this fiscal, which is the end of June, or into the next fiscal?
It'll be they usually look at a few years down the road, so it'll be for every year. And we will have to make an adjustment based on the number that they give us.
Okay.
Yeah, so we've been, I'm just going to throw out some numbers here so people understand. A 1 percentage point drop from the Council on Revenues equals about $74 million of operating monies. So, for instance, the council said 4 point something percent. That's how much money we've had to work with. A 1 percentage drop is 74 million. So think about things, the big ticket items that we have going this year. The Senate will have to deal with the new numbers that come out. And so we have, we're starting looking at our own internal projections and looking at what would happen if a 1% drop, 74 million. If we have a 2% drop, that's $148 million that we have to reduce the budget by. And, we have some really great programs that we're trying to stand up this year. So we're watching it very carefully. I know the tourism industry has given us briefings about they're already seeing the initial downticks, and we're predicting that within the next 2 months, I think it'll be more more dire than it is now.
Well, that's the question that just came over on the Slack channel. What are the latest indicators from the tourism industry? I believe Chris Tatum was advising you folks the other day, the CEO and president of the Hawaii Tourism Authority. And we are looking not just from Asia, but cancellation probably of meetings, conventions here.
Yeah. And actually, some of the numbers he gives us, it's like we most of our tourists are from North America. And so really the thing that we're watching very closely are cases in California, cases in Washington, Oregon, other parts of the U.S. Because that's the bulk of our tourists.
In fact, the West Coast is our biggest market. Yeah. Did you have some numbers?
Yeah. So the other dynamic that we have to kind of watch is the timeshare market, right? Because you have hotel rooms versus timeshares. And when when 9/11 occurred, there was a drop in hotel room use throughout the state, but Kauai was actually still a little positive because of the number of timeshare units that were on Kauai at that time. Because even though there was a crisis, people were still going to Kauai to use their timeshare units. It may be a little bit different this time because there are more timeshare units that are owned by Asian citizens outside of Hawaii. And in that situation, I think what the tourism industry is finding is that the Asians are not using their units. And so the timeshare market may not be as resilient this time as it was during 9/11.
Okay. Eleni, I think you're flying somewhere a little bit later this month. I'm not saying for what purpose, but how are you going to fly? What are you going to do? How do you prepare? Yeah. How does one prepare to fly domestically, not internationally, if you could even get an international flight? Tips?
Well, it's a lot of it is up to the person who's traveling. But one thing that our Department of Health has continued to say is they discourage any travel to Japan, South Korea, Iran, Italy. I might be missing another one, obviously China. So that still stands. So if you did have a trip planned for there, you might really want to think about it or call the Department of Health, see what they have to say about it. In some cases, I think airlines are hopefully becoming a little bit more flexible with canceling bookings. But for other areas, I would say just keep track of what the federal health agency is recommending. At this point in time, there is no, they aren't discouraging folks from traveling to, say, California. And that might change, and it changes every day. So you can also sign up for the daily update from the Hawaii Department of Health. And the CDC website online is also pretty accessible and has good updates and really good travel guidance.
Terrific. Ben Nishimoto, our Director of Philanthropy, reminding me if you still needed to get your white card, your Q&A card to Civil Beat so that I can read it. They're around here somewhere, but we have a bunch of questions. I am going to deal with the ones that came in beforehand. A lot of them, as you can imagine, duplicate. Gee, there's always questions about gut and replace. How about that? I don't know if I'm going to ask anything about that today. Let's move on briefly to get an update from Scott and Kalani on the joint package. As you know, a very unusual situation in which the leaders of the House and the Senate, as well as community leaders, business leaders, the governor, signed on to a joint package. Give us an update on the status of those bills. I believe 2 of them moved through the Senate yesterday and the other 2 through the House. I think we'll start with Kalani.
Well, let's take the overview. It is unprecedented, and it's something that, we're very proud of, that we could actually sit down and come to an agreement between the House and the Senate and the executive that these items are top of the list, and we have to deal with them across the board. So the 4 major bills were put together. The work was divided. The House took 2 bills. We took 2 bills. We've passed the 2 bills out. And, I want to stress, that the bills we put forward, as you saw in the process, was the beginning point of the discussion. As you could see, it changed in the Senate. It changed in the House. Amendments were made. Things were added and taken out, and so it's still a work in progress. We passed out our 2 bills yesterday, and we're sending them over to the House. We're waiting for their bills to come on over. And, just again, I'm giving the big overview. the idea, though, is that we have to look at, well-being of everyone in Hawaii, and how do we help everyone succeed, everyone find shelter, everyone find a decent way to make a living, right? And so we have to consider. I'm going to talk about the probably the most controversial one, which is the one that deals with minimum wage and all of those things. What we did was, if you just raise a minimum wage, you're giving more money. Then that bowl of saimin that used to be $10 goes up to $12. So you made $2 more, but everything rises. And we heard very loud and clear from the people that they need a little bit more to survive. We also heard loud and clear from the people that run the small businesses. The big businesses have said, we can make things work. The small businesses, what was really compelling to me is one of our own, Representative Lindy Coit, who is a business person. She's a farmer. She's the largest sweet potato grower in Hawaii, 800 acres of sweet potatoes on Molokai. And, she came down to me. She says, okay, who do you want me to lay off, my husband or my son? Right? If you guys bring it up to 15, 17, I can't make it work. Right? So for me, that really got me thinking about how do we balance it so that the businesses can survive, which then means our people have jobs and they can survive. The idea is to raise the standards and quality of living and not have the cost of living go up. So and great minds, went into this about if we create a package, Bert?
I don't think it was snickering over there, were they?
That was a snicker from Bert. You weren't one of the great minds, don't worry.
Representative Kobayashi over there.
But, so they came up with the idea that let's look at some of the taxing side. In essence, I'm going to use the term subsidy because it's really the government subsidizing a good part of the increase in income that goes to people. And we're doing this through reimbursable tax credits, the earned income tax credit, the food tax credit. All of these will be, so previously you had to pay a tax in order to get it, and it was on a sliding scale. What we're proposing is we raise the minimum wage a little bit, and along with that, we give you these tax breaks. So you file your taxes. If you have 4 children, it's $150 per child, per person for the food tax credit. You get that. Earned income tax credits, a few others. So we're hoping to put more money into people's hands immediately, raise the minimum wage a little bit, and the package becomes a larger increase and therefore helps to raise people's income, but keeping the costs down. So that's a real quick roundup on that.
If I may, just some other representatives and/or senators, Representative Val Okimoto there in the back, who tried unsuccessfully to amend the minimum wage bill. Nice try. I think I saw Chris Lee playing photographer. I don't know if he's ducked out yet. Am I missing any other lawmakers that are in the room? This is the first time I've ever, Sherry, correct me if I'm wrong, but Sherry McNamara from the Chamber of Commerce, is this the first time your organization has actually endorsed an increase to the minimum wage? Yes. Okay. Okay. I wanted to ask quickly from Scott and Kalani, because I do have a couple more questions about the joint package, and then I want to move on to vaping and flavored tobacco with Eleni. Is it just going to be $13? Is that it? Is it going to go any higher, or are you just willing today to say we're going to keep it at 13?
Well, the House moved out a bill yesterday that reaches $13. So that is the House. That's in the House version.
Okay, over to your side.
Yeah, that's going to be the vehicle, right? So, on our side is going to be a discussion, but I think, like I just explained, it's not just the one thing; it's the package, and we have to take it as a package.
The earned income tax credit, the GET exemptions, and so.
Well, yeah. So, Chad, what really hit the legislature hard about 1.5 years ago was when the Aloha United Way and the Hawaii Community Foundation issued a report on the status of working families in Hawaii, and the finding there was
this the Alice report?
The Alice report, and which is basically working families that can't make it in Hawaii. The finding was that 47% of the households in Hawaii could not meet basic needs. And the top cost drivers in those households were the cost of childcare, housing, and food. And so as Kalani mentioned, our package directly addresses the impact of those three cost drivers. We have a bill, a proposal to not just increase the minimum wage, but to also provide tax relief to low-income families, working families. We have a proposal to develop a childcare program in the state of Hawaii. As you know, childcare costs maybe $700 a month per child, $800 per month per child. And third, we have a proposal to increase the inventory of affordable housing.
I believe pre-K education is also a component of the joint package. Speaking of, and this is the last point I want to talk about before moving on to vaping and flavored tobacco, my take is the most controversial bill in that joint package of the four did move out of the Senate Bill 3103. And this is the one to create a school facilities agency. And among the things that are included in the bill is to exempt it, meaning this new organization, from all county ordinances, the historic preservation laws, the environmental impact statement law, I think that's HRS chapter 343, civil service law, public procurement code. You actually had prominent public sector unions, the UPW, I believe, HGEA, testifying against, and also the environmental groups. I'm going to read you a quote from Hawaii's Thousand Friends, an environmental group. It's unclear why this agency and board or any state and county agency or board should be exempt from laws that are in place to protect the public's interest, health, safety, welfare, and our island's finite and fragile nature and cultural resources. I believe there would be a sunshine law exemption as well, Brian. I'm looking, Brian Black from the Civil Law Center as well.
I want to see what he looks like.
You've never?
He quoted me in some proceeding from this last year, so I wanted to see who that was.
That's him. That's the one. So thus far, this is the bill that Sierra Club, others have their eye on. Why are you giving all these exemptions to laws that you created in order to build this new school facilities agency? I'll ask both of you to respond. It is in the Senate. Just move over to the House, but it is part of the joint package.
Okay, well, so let me put it this way. We have other agencies that have very similar type of exemptions. Hawaii Tourism Authority. It doesn't mean that they exercise it. What they end up doing is creating an internal system that usually mimics those exemptions that they have. So, for example, HTA will have an internal procurement system, and they have a very open process that they work through. You can go online and look at all of how they put together their grants, how they put together their budgets. But the idea is that, Department of Education has constantly told us, we are in the business of educating. We're not contractors. We don't build. So we heard them and we said, okay, yes, you're right. We're going to create an agency that builds the buildings for us because, I just have to maybe express the collective disappointment of the legislature in the department in the fact that they probably have about $750 million of unexpended appropriations that this legislature gave them to build school buildings and fix our schools. Is that acceptable? No. And that's why we're taking this action to say, all right, you guys can't do it. You've proven to us you can't do it because you've lapsed all this money. You've let the projects go. You haven't responded to what we've put in, what the governor's asked for. We have a very mercurial Board of Education that doesn't come around. We don't see them. We don't hear them. We don't, what are they doing? So what we decided was let's create an agency that all they do is build the buildings. And we have to give them the ability. The exemptions are simply to say, okay, you can start off. And then once we get them stood up, I believe, as we have done in the past, because there are other agencies with these types of exemptions. When they're started up, once they begin, they'll come back and say, here, in our rulemaking, here's our process for procurement. here's our process for historic preservation. Here's our process. It's simply saying it's allowing to shorten the time. It's allowing to, so the exemption is simply to allow them to start off fresh, but when they do what's called the administrative rules, all of these issues will be addressed.
Scott, you want to address that as well?
Yeah. So, in part, this proposal does reflect the legislature's frustration with the current system. I'm not sure why it should take 6 years to install a playground equipment at Lunalilo Elementary School in the McCully area.
Your district.
Yes, it is. This bill is proposing to just facilitate the modernization of our school facilities, and it is focused on existing school property. So where you have a need to rebuild or to expand with preschool classrooms, for example, we want to give this agency the ability to do that and the flexibility. The whole issue of who should be responsible for school facility development has just gone back and forth over the past couple of decades, because at one time, school construction was under the jurisdiction of the Department of Accounting and General Services. There was frustration there with them because it was taking so long. So it shifted over to the Department of Education about 12 years ago. But now you still see the same delays occurring, and there's very, very little progress or incremental progress. But we need to respond more quickly to the needs.
So the criticism is that when you're trying to expedite the process, another way of looking at it is you're trying to run around what is already established statute in order to prevent something bad from happening. For example, if you're building something on a school, do you give up standard EIS procedures in order to simply get that new building up? That is I think one of the primary criticisms, that these have long been established on our books. Why cut through it?
I think what you'll see with the development is development occurring on school property, DOE land, school property. You'll see buildings being replaced or expanded. So the impact may not be as significant as some fear.
Okay. All right. Let's move on to flavored tobacco and e-cigarettes. And actually, this is one of the first questions that came over. And Eleni, this is for you. Although the senator and the president are allowed, the majority leader and the speaker are allowed to weigh in. Will the legislature, Eleni, step up and address the youth vaping crisis in Hawaii by eliminating the sale of flavored tobacco products?
There's been a lot of movement this session, and there's, I think, about 4 bills still on the table. They all vary slightly. But when you consider that vaping has been on the scene for about a decade now, and we've seen the results of that, Hawaii's middle schoolers and high schoolers vape at some of the highest rates in the nation. There's definitely a consensus among lawmakers, I believe, that they want to pass some sort of legislation this session. And I know you folks co-sponsor some of these. But the first one I'll mention is Senate Bill 2903. It's part of the governor's package. What's different about that one is it would also ban the sale of menthol flavored tobacco products. So it's an overall ban on all flavored tobacco products, including menthol. And so that's pretty significant considering that menthol cigarettes traditionally have been, when you look at studies, they've been targeted to African Americans, and also in Hawaii, when you look at traditional combustible cigarettes, they are also very highly used among Native Hawaiian and Filipino populations here. So including that in the flavor ban for all tobacco products is it's a very broad ban. The other bill that I wanted to mention is Senate Bill 2538. This one is also a pretty comprehensive ban that would ban the sale of all flavored tobacco products. It also goes a step further by establishing fines and penalties and it authorizes a court to require people caught in violation to participate in a tobacco education program, for example. And if a minor is convicted, then the decision would go to the parents on what type of penalty the minor would face. And then the third one I wanted to mention is Senate Bill 2228. And that one prohibits the sale of flavored products for e-cigarette or ESDs, electronic smoking devices. So that one isn't as broad as a flavor ban on all tobacco products. That one would solely be looking at electronic smoking devices. So it's going to be really interesting to follow these bills, to see how they develop and, any tweaks that might be made to them going forward.
Thanks, Eleni. One question as a follow-up, and then whether Scott and Kalani want to chime in on this topic. Is vaping bad for you? Are e-cigarettes bad? I'm still confused on the science. You hear people say, oh, it's better than cigarettes or something. What do we know?
So I think the general concern that I hear, especially from doctors, is that we have a new generation addicted to nicotine, but not in the same way as cigarette nicotine. You have these cartridges and pods that have nicotine at more, sometimes I think more than triple the amount that you might find in a pack of cigarettes.
Concentration.
The concentration of the e-liquid juice has very high levels of nicotine, which is why these devices are so addicting. And we're still trying to understand the effects on younger brains. And it's also interesting because 1 in 4 Hawaii high schoolers have admitted to using a vaping device within the last month. So looking at how the popularity has exploded in Hawaii.
Nationwide, right? Is that right?
Yeah, so we have the highest middle school vaping rate in Hawaii in the nation, and second highest in the nation. But these stats are based on 2017 data, which is the most recent. So it'll be really interesting to see the 2019 results when they do come out.
Thank you. And sorry for interrupting you. Scott, the will in your chamber to advance some of these measures?
Yeah, so, the House members are well aware of the public health concerns surrounding vaping, especially with children. So I'm hopeful that we'll move some legislation this year.
And I believe in your chamber yesterday, several of these measures, the two of them that I think Eleni just mentioned, actually did cross over.
Yes, we did. So the Senate did pass over these bills. It's one of our priorities. And, that's what we put out to the public, was that we will be dealing, the Senate will be dealing with this, which we did. So the bills have gone over to the House. Our respective chairs, I know, are talking, the Senate chair and the House chair are talking about working on the bills together. So I'm pretty hopeful that we'll have something passed this year.
Roz Baker in the Senate, in the House, that would be, who is your health?
Just one thing to add in terms of the concern about vaping. I forgot to mention EVALI, which you have all heard about. It's vaping-related respiratory illnesses. In Hawaii, the most recent count was 4. So we've had 4 cases of respiratory illness that doctors tracked back to using a vaping device. I don't think we have the details on exactly why, but looking across the nation, a lot of them have been related to vitamin E acetate or THC oils. But I think we've had a case from every single county here in Hawaii, but it's been 4, which is smaller compared to other states that we're seeing a large number of EVALI cases.
I can't believe I'm blanking on the health chair in the House.
John
Mizuno. Oh, he's going to kill me. All right, moving on to pet bills. This is particularly for Scott and for Kalani. Scott, one of your pet bills that you've been pushing year after year unsuccessfully, the emoluments bill, House Bill 361 rather, is moving. We call it the emoluments bill, but some people call it the Kirk Caldwell bill. And I wondered if you might tell us what this bill does and why it's important to you.
Well, it's actually the Donald Trump bill. So, as people who know me know that I'm not really political, but what Donald Trump did was just bothered me a lot. So I looked at our state laws to see whether there's any kind of prohibition on emoluments.
Our emoluments.
It's basically earning income for a chief executive who earns income outside of that position.
Okay.
Basically as a side job.
Okay. So in Trump's case, the Trump Tower or whatever. Okay.
Right.
And originally it was from a foreign government. Yeah.
State law was not very clear with respect to the governor, and it was not clear at all with respect to mayors. So this bill, House Bill 361, will establish an emoluments standard for the governor and each of the mayors, beginning with the election of the new person.
So it won't apply to Kirk Caldwell, but if it did, he would not, if this bill were law, he would not be able to serve on the board of, is it Territorial Savings, and to get $150,000 a year and whatever the latest figure is. I'll have to check with the Ethics Commission. I think they put those forms back online. But
I mean, the rationale is that serving as governor or mayor, I mean, that is a full-time job. So you should be focused entirely on that position and not have a side
Understood.
job.
I think Derek Kawakami, the mayor of Kauai, would be affected because of his family's interest in the stores over there. Is that right? So, but Governor, as far as I know, Governor Ige does not have a second job. But sounds like this bill might be moving forward. And then Kalani, before we shift back to Eleni with another question, I wouldn't call them necessarily pet bills because these are bills that have wide ramifications for everybody, but it really has to do with mitigating, combating climate change, sea level rise, if you will.
So, the Senate, let me just take the really big picture. The Senate has adopted the 17 UN Sustainable Development Goals. The executive has done it through an executive order. So all the departments are implementing it. All 4 counties have implemented it. So, in effect, what this means is that in Hawaii, we're not debating whether or not climate change is happening. We're saying it is happening and what are the actions we're taking to do 2 things, mitigation, right? And then loss and mitigation and preparedness. We have a series of bills. So we stood up the Climate Change Commission a few years ago. They did something that if you haven't looked at this, just to get an idea, go to the, Google Hawaii Climate Change Commission and look at the chart that they did. You can go online and you can go down to a TMK, a piece of property along the coast and anywhere in Hawaii, and they will give you the predictions of when it will be inundated. So we have the indicators. So, we have people I was joking with some guys doing some renovations in Waikiki. I said, make sure your 3rd floor becomes the lobby, in your renovation plans. But this has been very helpful. It's been helpful for realtors, for example, because at first they were fighting, this particular maps coming out. And once it did, they're telling me, look, somebody comes along, I tell them, go over here. This is what the government's predicting. You still want the property. They've met their disclosure. They've met their, it's a government agency putting out the information. So we're very, we've done the easy stuff. We've set the goals. We've set the commissions. We're looking at it. The hard stuff is right before us. And, I'm going to use the nice term, which is called planned retreat. What that means is that we have to take some hard decisions about moving infrastructure and other key components inland. On Oahu, we Kamehameha Highway and Hauula and all of that going into the ocean. But let's talk about the other places. I have an area on Molokai that probably 10 feet left on the pavement. The other side has fallen into the ocean. If that goes, I have the entire east side of Molokai isolated. We have contingency plans that should that go, how do we get food, supplies, etc. in there? On Hana, where I live, the road is constantly falling into the ocean. Our tourist areas, going to Lahaina. I mean, luckily, Senator Baker and the Representative McKelvey and others have worked very hard to move that highway inland, and we're doing it. But we also have parts falling into the ocean right now. The Big Island, same thing. Kauai, the same thing. The hard part is how do we, and it's going to come back to your question about these facilities, how do we move our critical infrastructure inland in a timely manner, given the set of rules that we have? To move a power plant, I've been told by the power company, it's about 25 to 30 years of permitting. We don't have that much time. Ma'alaya, I'm going to use my example on Maui. Ma'alaya power plant is in the marshes. And when we talked to them earlier, they said, we're going to put a seawall out. But they said, well, go take a look at this map that the government put up. They came back and said, oh, the seawall isn't going to work. Then they said, okay, tell us where you want to move it. And if you guys tell us and you guys clear the regulatory path, we'll begin looking at moving it. this is the question, right? So we're going to have to make some very hard decisions based on
Some
that.
of those bills moving, by the way, a carbon tax. It looks like it did pass out of the Senate over to the House, requiring rental cars to have zero emissions. And then an initiative to plant more trees, which I personally support. Quickly, Eleni, tell us a little bit about fluoride. Boy, that's an open-ended question. Tell us a little bit about fluoride. There were two bills, one pro-fluoride, one anti-fluoride, and yet Hawaii seems to have this inability to move forward, some concerns about fluoride.
Yeah, I thought this was kind of a great example for our Fault Lines project at Civil Beat. This is something that has been discussed over and over, but difficult to get to agreement. And this session was really interesting because there were these two bills that had the totally opposite intention. Neither of them advanced. Both of those bills are dead, but it was interesting to speak with the folks on both sides. The first was a proposal to ban water fluoridation going forward in Hawaii forevermore. And then the other was to propose that we do fluoridate water. The reason why this is so contentious, I think, is because there's a very strong community that has a lot of concerns about the safety about fluoride. And those kind of come in tangent with the fact that now about 70% of Americans actually do drink fluoridated water. It's something that's recommended by not only the Hawaii Dental Association, but the World Health Organization and the American Academy of Pediatrics. So anyhow, the reason why we haven't really seen a consensus is because each time this pops up, basically the opposition raises the question of fluoride safety, and then the scientific community might reject those claims, which in turn sort of sows more doubt in the community.
Okay. Scott, Kalani, where do you stand on fluoride for our water system?
I'm not sure that that the public is ready for mandatory fluoridation at this point. It's something that we'd have to really assess and be slow to move on, even though we know what the benefits of fluoride are. So the alternative is to really focus in on the programs that used to be at one time were in the public schools where there was fluoridation treatment for younger students.
Kalani?
Yeah, no, I echo the speaker's sentiments.
These are round robin, quick questions, short answers with the last 15 minutes. The first question is on the matter of integrity. It comes from
Mrs. Blair, is that your mom?
It comes from my mom.
Your mom does the most comments on that doesn't get deleted from Civil Beat.
Oh, boy. Love you, Mom. Of course, this is classic Mom. Is the legislature as a whole acting from a place of integrity?
Yes. Next question.
Scott.
Absolutely.
Okay, and Eleni, forgive me, most of these are for Scott and Kalani. Why do committee chairs have so much power?
Okay, so the way the system is set up, we have many different subject matters in the Senate. We have 16 committees, and think of it this way: you're in college and you have to take 16 classes. Do you become the professor of health, the professor of transportation? You rely on your colleagues. So the committee chair, we rely on each committee chair to be the expert on that issue, to suss through the issues, to come up with the plan, and then they make the recommendations. That's why there's a vote in the committee. That's a recommendation to the full body to take action. So the chairs have that much power because they're the ones entrusted to think through the issue and come up with the plan.
Scott, anything you'd add to that or disagree with?
Yeah, so decision making has devolved because the alternative to having engaged committee chairs is to have a dictatorial speaker or a Senate president, and I think it's better to have chairs who have the authority to help make decisions.
You don't have ambitions to be dictatorial? Next question: jails. Why is the state pushing to build new jails and prisons to address overcrowding, rather than implementing bail and sentencing reform and other evidence-based policies to successfully reduce the incarcerated population as has been achieved elsewhere? Kalani.
Okay, so this is one of these monolithic questions. When you say the state, the state is many different facets. So there's some aspects within the state system that want to do this. I'll give you a good example of building a new jail on Maui. They've been trying to do it for many, many, many years, and that at least the Maui Senate delegation has been. We said yes, we do need to reduce the overcrowding, but why are we going to spend $500 million on a jail and we can't do better with our community college and our Maui college, right? So the idea behind this is that, and I tell my colleagues this all the time, part of it is our fault. We create everything as a Class C felony, a Class B felony. We should look at civil fines, civil forfeitures, other types of penalties, but not the incarceration, because incarceration for certain, and I'm not saying for all crimes, I'm saying for certain crimes, incarceration might not be the best way to deal with it. So it's a very complex issue, and it's one that's hotly debated within various parts of the government.
Of course, with the Maui jail, that's the one where we had the riots of last year.
That's because they're completely overcrowded.
And a lot of them not able to pay for their bail, correct? And that's why you have people crammed in there.
And to answer the other part of that question, we have taken up the idea of bail reform. We've had hearings on it. Many of us are, it's become an economic issue. Again, if you have the money, you can make the bail. If you don't have the money, you cannot. We have to have another criteria, and that's what we're trying to find. There's huge national trends that we're watching. And, I know at least on the Senate side, our guys are debating it and talking about it.
Okay. Scott, your chamber, of course, there has been discussion to buy the Federal Detention Center as a replacement for OCCC. I think from Greg Takayama, your public safety chair, but jails and prisons, overcrowding versus reform.
So we're doing both. We're looking at it from the front end as well as from the back end. For example, this year we have legislation moving that will create more diversion programs for offenders. On the flip side, I think we need to take a serious look at modernizing our correctional facilities, especially if we can incorporate more mental health and medical treatment services in those facilities.
Cesspools, with all the discussion about climate change affecting our reefs, this is particularly your district, I think we seem to continue to ignore an important impact. Cesspools, what action is the legislature taking to create a real action plan? The EPA has really dinged the state over this. Kalani?
Yes, so, S happens. We have to deal with it, right? And here's the problem. We have about 88,000 plus cesspools in the state of Hawaii. Most of them were legal. In other words, they were built with permits. They were built with government consent from the counties and from the state. The problem is we didn't know that certain things were leaching into the water supply. And now that we do know this, we have to take action. The federal government has been pretty draconian in how they wanted to do it. Basically, I think the first proposal speaker was, shut everything down in the next 5 years. And if not, we're going to start fining everybody, thousands of dollars a day if they don't do it. So what we did was we passed a bill a few years ago that said, okay, we're going to try and convert everything by 2050, if I remember correctly. And we also set up a working group that's doing a lot of work looking at how to do this. We've divided it into zones, priority zones. What's sitting on the aquifers, what's sitting on the near the shorelines where it's seeping into the ocean. We set up a program which frankly didn't work. It's a tax credit. In other words, I think it was $10,000. Yeah, you've had to have paid $10,000 in taxes to get it back, right? So it didn't quite work. But the short of it is that we do have to do the conversions. And I think that the pathway forward is a multi-level approach, different responses for different soil types in different areas. And we have to look at new technologies. So part of it is making sure that we work closely with the EPA, Clean Drinking Water people, Department of Health, so that when a new technology comes along, that we can actually use, that they approve it. So, for example, I have places up country in Maui. Remember the old plantations, those real small lots and real small homes? They can't get into the existing cesspools. They can't get machines in to replace. So we're looking for technologies that you replace in the existing puka, right, in existing holes. Multiple technologies. It's an ongoing debate, and we have a lot of really great minds working on it.
Scott, cesspools, did you want to add? I don't think there's many in your district. Are there any? I don't know.
I don't
I don't think so. Anything that you would add to what Kalani had to say?
No, Kalani's correct. I think we're going to have to rely on new technology to help resolve this. Like in the movie The Martian.
The Matt Damon?
Matt Damon. Well, I mean, the Bill Gates Foundation is looking at flushless toilet systems, and I think they have pilot programs in China. So we're going to have to look at these kinds of alternatives.
Okay, a couple more. Joint task force that we were talking, joint task force, the joint package from the House and Senate that we talked about earlier. This is my question. How did you manage to keep that secret from the media? How did that not leak out?
If we told you, you would know.
But it's my job to know because I got to tell them. I mean, I don't know how you did it. It was amazing. Scott?
I just like to keep Chad Blair on his toes all the time.
You are all too successful at doing that. Another question from folks in the audience. Can the Salary Commission stop the imminent pay raises for elected officials? Judges' salaries should not be linked to elected officials. Salary Commission. Your pay raise stepped up, goes into effect in January, right? And it's going to be about a $15,000 raise.
Okay, let's take it the other way around.
Okay.
Previously, the Salary Commission, there wasn't a salary. It was the legislature that had to do it. So, people were upset about that. And frankly, from the 80s until the early 2000s, the legislature did not get a raise. And we were very, 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 very far behind. So if you look at the type of work we do, we deal with a $28 billion budget. We make decisions like a corporate board, many for all intended purposes. We have to allocate very scarce resources. You think you want to pay people for the value that they're putting in, and you want to attract people that will do this. If you offer somebody $30,000 a year to do something like this, that's what you're going to get, right? Somebody that can afford to do this. So I think that's the first part. The second part is years ago, and I think I was here, so in the early 2000s, we changed the system. It went to a salary commission that we have nothing to do with. The commission looks at all the costs of salaries across the board, and they come up with a recommendation.
Although you do help appoint some of the people that serve on that commission. Yep. So
yeah, we do, and others appoint them as well.
Sure.
Yeah, and it affects judges, and it affects some executive department heads as well. So it became a much more fair system for everyone. And, I can tell you that those people on the commission work really hard. I know that they've asked national organizations such as the National NCSL, which Scott is going to be the president of, and other CSG West, Council of State Governments, other national think tanks about how do you come up with a salary for a legislative body and for judges and other ranking officials. So I think it's the best system we've had in years.
Okay. Scott?
Yeah, so prior to 2006, the salaries for the executive branch, the judicial branch, and the legislative branch were operated by separate commissions. There was a legislative salary commission, there was a judicial salary commission, and then for the executive branch, the legislature actually set the salaries by law, by statute, for each of the particular appointed positions. So, this was, as you can see, this was probably kind of an unwieldy process. So in 2006, there was a constitutional amendment that was placed on the general election ballot, and the voters approved it. This proposal created a salary commission that looks at and recommends salary adjustments for all three branches of government: the executive branch, the judicial branch, and the legislative branch. And that commission meets every 6 years to set salaries.
You think it works well?
I think it's a better system than the one that was in place prior to 2006.
Okay, I promised Kalani would be wrapping this up. I do want to ask each of you have any final remarks. Eleni, again, thank you for your patience. Is there anything else that you wanted to add? How it wasn't so bad, was it, participating in this?
It's great.
I think you did terrific. I hope you'll come back and join us. Anything else to add?
I mean, any other concerns about coronavirus questions?
She's the one
can
to
reach
talk
me
to.
outside, call me. Yeah.
Kalani, a final word?
Yeah, first of all, thank you all for coming. We really appreciate your participation, and thank you, Civil Beat, for bringing this forum together. I would like to say that the Senate and the House, we're two parts of one body. And, I've often had people tell us, well, how come you guys are always fighting? And I would say, the founding fathers of the American Constitution built it that way. If we weren't fighting, something is wrong. And what it is that we're discussing the issues, we are passionate about positions, and we're trying to come to the best solution. So, the joint packages are a very good example of us coming together, and we're still working out details. So, when you see what you consider fighting, it's really what the federal Constitution envisioned, and that's a good democracy at work.
Okay, Scott?
Yeah, so thanks Civil Beat for hosting this and inviting us. I want to thank all the viewers and everyone who's participated in this legislative session. As you know, this has been a really, really busy year for all of us. And I think that the issues that have come up, the topics that have come up this session are relevant to almost everybody in the state. And it's important that everybody just stay engaged in this process, because we really want to make good decisions at the end of session.
All right, I have a few closing remarks, but first, mahalo to Eleni Gill with Civil Beat, to Speaker Scott Saiki of the House of Representatives, and Kalani English, the Senate Majority Leader. Thanks for joining us today.